Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Hi, and thank you for joining us today on Between Two White Coats. Amber and I are jumping into kind of a heavy topic that is getting a lot of talk, and a lot of people are asking, like, what is this regenerative medicine stuff? So let's dig in and let people know, what is regenerative medicine? You may be hearing about things that fall under regenerative medicine with some stem cells that are being used more broadly, probably in ways that people don't even realize, and vampire facials, vampire facelifts, PRP. These are all different forms of regenerative medicine. So when I say regenerative medicine, what comes to your mind?
So when you have said that, and as we were talking earlier, so this was back when I was in high school. So this has been a long time ago at this point.
Amber is 23.
I am. But like with that, it was when stem cells, they had just started using stem cells, and I took a genetics class in high school. Loved it. It was one of the things that kind of got me really interested in medicine. And we had to do a project. And so I chose stem cells because I thought, what in the world? Like, this is kind of interesting. And so I made a long distance phone call when you had to pay long distance when you didn't have the cell phone that was free to California, because I looked it up and there was a place in California that was doing stem cells. And so they allowed me to talk to a Parkinson's patient who was one of their first patients to use stem cells. So like, I got in trouble for that phone call because it was quite expensive.
Yes.
But I remember thinking, wow, you can use these cells to help this patient's Parkinson's symptoms.
Yeah.
So when I think stem cells, like, that's immediately what I go back to, is that has probably been 1995-ish.
Yeah.
That I took that class. And so just the progression of what it is now versus what it was
people
then,
doing some research in this
for
area
a long
for a long time.
And so I think that sometimes people think, oh, this is all new, but it's not. Like,
well, and then we come up with phrases like regenerative medicine, which really means to regenerate, to build from within, to create new. Yeah. And then it sounds new because we're calling it something new, but we've been doing stuff with stem cells for a long time.
Yeah.
I think what comes to mind for me with when we hear stem cells is how people will typically be put off by the idea or phrase of stem cells because they think embryo. And a lot of people are taking the idea of stem cells, stem cell research, or stem cell treatments, and they're thinking that this somehow has things to do with abortion. And I would like to ask people to disengage those things in your mind, because stem cells can come from a lot of different places. The stem cells that we like that have a lot of potential are the embryonic stem cells, or stem cells from a baby, because these are undifferentiated stem cells. And if you've ever had the great fun of taking a course on any of the development of the human body, we start with we start as a zygote, a cell, and then that one cell becomes every cell in our body. So it can become muscle, it can become brain, it can become anything that we have. So if you can take that undifferentiated cell and then you can help guide it, the research, like you were talking to the expensive call in California, the researchers are finding ways to guide those stem cells to become particular things that we need. Yeah. But before we talk about what those stem cells can become, let's talk about where they come from, because I think that's where people get upset and think that this has become a religious or a political topic, when really I would like people to just put this in the category of science. Stem cells, if they are embryonic stem cells, most embryonic stem cells have come from fertility clinics. So when you donate sperm, egg, and you create an embryo, and then they do everything that helps that embryo to grow and be implanted, there are extras. And this is all done with great government regulation that people give permission for their extra embryos. So you implant 4 embryos, it becomes 4 babies, and now you have quadruplets, and you say, I do not need any more of those embryos that are in the bank at the infertility center because we've got our 4 babies. And so you give permission to then use those embryos that are being stored for research. And I think we have the choice to trash things or use them to advance science and help save lives. Thank you to the people who say yes to doing that. There are also other embryonic stem cells that can be taken from amniotic fluid, that can be taken from umbilical cords, that are harvested upon births of babies that are living healthy babies. And so those embryonic stem cells come from a lot of different places, and I'm just asking everyone to disengage this from any political or religious opposition that you may have to stem cells. Also, then we have adult stem cells. So we can take tissue that regenerates, like skin. We are constantly sloughing off our skin and building new skin from underneath. So they will take skin from a person. They will create an environment that the skin can reproduce itself in the lab, and then take that skin and put it back on that same patient to cover an area of a burn or to cover an area of injury. And so you can take your own cells and then replace other areas that you need. And so skin grafting has come a long way thanks to stem cells. There are also cells that can become skeletal muscle. You can harvest skeletal muscle. You can turn it into other things. You can turn cells into cardiac muscle. There's a number of different ways that we can take our own cells, blood, bone marrow. Bone marrow cells can be harvested and turned into a lot of different things. Our bone marrow turns over new cells, so we can take bone marrow out, turn it into something else, and then reuse it for a person. Lots of different areas that we're using this. One area is in type 1 diabetes. Diabetics, we actually have a cure for type 1 diabetes. We've taken stem cells. Harvard Stem Cell Institute has developed stem cells into fully differentiated pancreatic islet cells, and that's what makes your insulin. So we've been able to cure kids with type 1 diabetes because of stem cell research and regenerative medicine. It's very exciting. Tons of neurologic stuff. You mentioned Parkinson's, MS, strokes, spinal cord injuries. Being able to take a stem cell, encourage its growth to become a neuron, and then place it into the area of the injury of the spinal cord and let that grow into new cells and actually heal spinal cord injuries so that people are no longer paraplegic, quadriplegic. It's incredible how this is actually getting to the core of the problem and fixing it. Yeah. The other thing that I think is super exciting is artificial organs, that if we can take these stem cells and continue down this path of research, then we can actually create entirely artificial organs. So you don't have to, when you're on a donor list, wait for someone to die to receive an organ. And hopefully we can actually move people through transplant lists a lot faster. So I think
that would change the game for so many patients.
For so many people. I think there's so much exciting stuff going on with Alzheimer's research and heart disease and a lot of neurologic issues based on stem cells. So hopefully that sort of helps people understand one of the things that we're doing in regenerative medicine is stem cell. And one of the places, I know your husband is like, can you inject some stem cells in my shoulder? One of the places that we're doing a lot is musculoskeletal stuff. We can inject stem cells into areas of injury, and it helps to rebuild cartilage and replace from inside, really recognizing what's needed and helping to rebuild those cells. So it's fascinating and science at its best.
It decreases the inflammation and the pain. Yeah. Which is such a big deal, because when you live in chronic pain, to not to have something injected to be like,
Yeah.
that feels great. Why didn't I do this sooner?
Yes. And I'm actually healing my body from within with
often my own cells.
Yeah. It's, I think it's brilliant. It's super exciting. And so then that comes to, most of the time what people are asking us about is something that the Kardashians have brought to light. And so the Kardashians have brought to light PRP.
Yeah.
Talk to me about what is a vampire facelift? What is PRP?
PRP stands for plasma-rich platelet-rich plasma. I got that backwards.
Platelet-rich plasma.
Platelet-rich plasma. I'm trying to say that fast.
This is why they call it PRP.
PRP, because you got to say out all the words. But essentially, it just uses your own blood, and it accelerates healing. They spin it down in a centrifuge and just kind of get the platelets separated out. And then when you do a vampire facial, then you use this little device that kind of makes you bloody.
Yeah,
and then you smear your platelets on it. I've had this done.
Have you?
I have totally had this done, and I liked it.
Okay.
It was not scary. I was a little nervous when they were getting closer to my lips because I was like, oh gosh, I don't want it to go to my mouth. But
so there
I loved
it. This started. I think that we were doing the microneedling, and then we added to it the PRP as an extra advantage because the microneedling is these tiny superficial needles, and so they numb your face, right? And
ish.
And so how uncomfortable is the microneedling part?
It wasn't. I mean, it just felt like pressure.
Okay.
But I'm like vanity, so I'll take some pressure for some good facials.
And so then it creates these small little openings with the microneedles. That of itself helps stimulate collagen and helps stimulate healing, brings blood flow. When you create these tiny little injuries, if you will, it brings a lot of blood flow to the area. So you already get some healing and kind of a fresh look, and a little bit of the fine lines go away from just the microneedling. But then they took the microneedling further and took the platelet-rich plasma, the PRP, and rub it onto your face after the microneedling. So you have these small little openings that then you're putting your own platelets into. And the idea is that platelets have human growth factors, so it helps new things to grow. Platelets help to reduce inflammation. They have a lot of healing properties. They stimulate your own tissue to heal and generate new. So you create elastin and collagen, which pulls things a little bit tighter, which I think that's where it got the facelift name. It's not an actual surgical facelift. But it helps your body use its own cells to generate healing and new tissue, which then helps pull things a little bit tighter, gives you a little bit of a
low
glow.
risk.
Yeah.
Low risk because it's using your own stuff.
Yeah.
So
and so to break it down, Amber had small holes put in her face and then rubbed her own blood on it and got a facial out of the deal.
Very glowing.
So most importantly, could you tell a difference?
I could.
Yeah. When you see the befores and afters on this,
they are.
PRPs are I think PRP facials are very effective.
Yeah.
They will recommend that people get a series of them. Like if you get it, then maybe a month or two later, you want to do it again. But it really helps to generate this new growth. I think the fine lines, the sunken eyes, the bags under eyes, things like that really get lifted.
But they're doing it now for like hair regrowth.
Yes.
They also are doing vaginal rejuvenation. I have seen this PRP is now going into other areas of your body.
We're taking the science to say, well, if this helps these cells to grow, replicate, and be healthy, then what other area might it help cells to grow, replicate, and be healthy? So I think when we look at PRP, extracting your own blood, spinning it down in a centrifuge, pulling the platelets and the plasma, and then putting it somewhere that you need it so that you can create new growth. That's the whole idea. Decrease the inflammation, create new growth, self-healing. The places that we're seeing that the most are injected. So taking the PRP and injecting it into joints, decreasing inflammation, pain goes away mostly, if not entirely. And then it helps to regrow and heal those joints. Facials, for the reasons we've already talked about, using it on people's scalps so that it helps create that healthy environment for hair growth. It stimulates the hair follicles for new growth. Lots of great results for male pattern baldness treatment. And and using it for other, vaginal rejuvenation or other cells that they may recognize. I think we'll see more and more of different ways that PRP can be used. I think, when we talk about regenerative medicine, we're talking about really trying to heal with our own or someone else's stem cells or our own platelets. We break this down into really stem cells and all the places that stem cells can come from. And I think it's unlimited use that we're going to see over time of how stem cells can help heal us. And then using our own cells, and bone marrow and blood cells are two of the cells that really are being used a lot. And the PRP is being able to use our own platelets to do what platelets already do. They help things heal. They help things grow and place them into places that we need them to heal and grow. I have great excitement for all the different things that PRP and stem cells can do. We have a lot of excitement for adding regenerative medicine as part of our practice. If I had the option to inject someone's joint with a steroid or inject someone's joint with their own healing cells, it's kind of a no-brainer.
Yeah.
We have a couple of doctors here who do a lot of joint injections, and they're very skilled at it. And they're super excited to be able to expand what they can actually inject. The process is the same. It's just putting something different in there and putting your own cells so that we're actually healing the problem instead of medicating the problem is really exciting. If you are interested, again, there's a lot on regenerative medicine online. It's often done in the facial and hair growth world. It's often done through cosmetics or plastic surgeons. But there's a lot of different places where you can get access to PRP, including practices like ours in primary care that are expanding into this, as well as a number of different wellness centers. So look in your area. I think it is worth a conversation with your primary care provider or with whomever you may seek out, your orthopedic. I will say one thing to know is that this is frequently not covered by insurance, that there may be an out-of-pocket cost to this, so that's something to ask about. But if it's something you're interested in, we think it's safe, we think it's smart, and really, I think it's science at its best.
We like to leave you on a good note, so here's today's Tell Me Something Good. Something good is mistakes. We all make them, none of us are perfect, and I like to think of mistakes as opportunities. Opportunities to learn, opportunities to be humble, and to grow. So embrace the next mistake you make. I expect mine will be in the next 5 minutes. Thank you so much for listening, and until next time, take care of yourself.